After much deliberation, I decided to make this video. The reason for my hesitation was concern that the content of this video might provoke stronger backlash than expected from academic societies or from some medical professionals who hold negative views about stem cell therapy for cerebrovascular diseases. To be honest, I myself have a lot of doubts about the stem cell treatments that are being advertised by many hospitals these days, and I've even seen many ads that make me feel a sense of aversion. However, I believe that in order to criticize treatments performed by other medical professionals, you need to know more than others, and not just stop at knowing, but actually experience it yourself before you can make a reasonable critique. That's why, until now, I have not made any comments about the cerebrovascular stem cell treatments performed by other doctors at other hospitals. As a neurosurgeon, when I was a fellow at a university hospital, my paternal grandmother was diagnosed with cerebral infarction and was admitted to a university hospital in a provincial area. However, the only treatments my grandmother could receive were oral medication with aspirin and rehabilitation therapy. My family told me in frustration that my grandmother was paralyzed on one side and couldn't even walk, but the attending physician said there was nothing more to do except transfer her to a rehabilitation hospital and hope she would recover through rehab therapy. I imagine there are quite a few people who have had similar experiences. As a neurosurgeon, I've seen so many cases like this that I completely understand, but I can see how, from the family's perspective, it could seem utterly absurd. Medicine has advanced so much these days. It's only natural to question whether there really is nothing that can be done for a patient with paralysis. In cases like cerebral hemorrhage, where blood accumulates inside the brain, as long as the patient's neurological condition doesn't deteriorate rapidly, there is usually a relatively sufficient golden time. Even if a cerebral hemorrhage occurs today, it's common to first reduce brain swelling with medication and induce hemostasis, then perform brain surgery a day or two later. However, in the case of cerebral infarction, treatment must be administered within 4 to 6 hours in order to perform thrombolysis, which dissolves the blood clot causing the stroke. But if a cerebral infarction is discovered after 6 hours have passed, the only treatments available are taking medications to improve blood circulation and undergoing rehabilitation therapy. But this situation has not changed at all, whether it was 30 or 40 years ago when my mentors were in training or now, and this is not only the case in our country, but is the same worldwide. No matter how excellent a hospital you go to abroad, the basic situation does not change. In this way, once the golden time has passed for a cerebral infarction, even if the after effects such as paralysis or language disorders are severe, it is difficult to expect any special treatment, and you are faced with the truly unfortunate and daunting reality of having to entrust your fate to rehabilitation. When something like this happened to my own family, even though I understood it intellectually, I couldn't help but blame myself in my heart, and I found myself constantly wondering why we don't actively research and try other methods. As a result of that struggle, I became interested in stem cell therapy and have studied it more than most people. A few years ago, with the help of a junior colleague at Kyushu University in Japan, I had the opportunity to visit the Kyushu University Stem Cell Clinic, and I was very hopeful. However, I ended up coming back with nothing but disappointment, as it fell short of my expectations. While studying on my own again, I started looking for doctors who had wrestled with the same concerns as I had, and were actually performing stem cell therapy in clinical practice. As a result, I met Director Hyun-Soo Kim, who gave me a great deal of courage, knowledge, and wisdom at the time, and although it was a short period, I was able to learn many valuable lessons. Although I regret that I can only do so through this video, I sincerely want to express my gratitude to Director Hyun-Soo Kim. I remember being even more encouraged when Director Kim said that since most patients seeking stem cell treatment have neurological disorders, it would be wonderful if neurologists or neurosurgeons took a greater interest in this field and participated more actively. Returning to the main topic, I would like to introduce 2 cases of stem cell treatment that were actually performed on stroke patients. The first case is a 68-year-old male patient who suddenly developed a stroke, resulting in a language disorder. He was admitted to a university hospital in Busan and diagnosed with a stroke, but unfortunately, as I explained earlier, he was discovered after the golden time had already passed. While undergoing rehabilitation and being told by the doctor to wait and see, the patient was willing to try any treatment that might help. He tried alternative medicine at an Oriental medicine clinic and various other treatments, and during this process, he ended up receiving stem cell therapy at the hospital where I work. In Korea, it is a legal treatment method to collect one's own stem cells without culturing or manipulating them, simply isolating and concentrating them for personal use. Accordingly, this patient also had stem cells collected from his own bone marrow, which were then isolated, concentrated, and injected into his bloodstream. However, there is one clear difference between stem cell treatments for cosmetic or anti-aging purposes and those for brain diseases. That difference is the so-called blood-brain barrier. If this barrier does not open, even if stem cells are injected, they cannot actually be delivered from the blood vessels in the brain to the brain cells. After performing a procedure to address this issue, we administered stem cell treatment twice, and the patient experienced a truly dramatic improvement. If I just say that the symptoms improved, many people might not believe it. So I will show you the MRI images from before and after the treatment. If you look at this MRI, please focus on the white area inside the square on the left MRI image. Normally, the brain appears as a dark gray color, but when a cerebral infarction occurs and brain cells are destroyed, the brain turns white. And importantly, there are also lighter white areas surrounding the part of the brain that has turned white. The darker the white area, the more brain cells have died, while the lighter white area on the outside is where living and dead brain cells are mixed together. In my opinion, the purpose of stem cells is not to revive completely dead nerve cells. However, aside from the completely dead nerve cells, I believe the purpose of stem cells is to save the cells in the surrounding areas where living and dead cells are mixed. These mixed areas are at risk because living cells can also die due to various immune responses, inflammatory reactions, and blood circulation disorders. So, when stem cells are injected, the areas where living and dead cells are mixed show functional improvement. As a result, even on MRI scans, you can see that these mixed areas change to the color of normal brain cells. In fact, this person was the father of a close friend of mine. The second case is a patient who was treated for right-sided hemiplegia after a brainstem infarction, also known as a stroke in the medulla oblongata. This person was a medical professional and he also underwent 2 treatments. If you look at the before and after treatment photos, just like I explained earlier, the white areas in the background appear as white spots as indicated by the arrows. Before the treatment, you can see these white spots, but after 2 rounds of stem cell therapy, you can see that most of the white spots have almost disappeared. The disappearance of these white spots does not mean that the brain infarction has been completely cured. When brain cells are damaged by a cerebral infarction and after effects remain, there are parts that recover naturally over time. One of the factors that determines this recovery is whether the area where living and dead cells are mixed, as I mentioned, comes back to life and regains its function, or whether it dies due to fibrosis or necrosis and loses its function. The difference between these 2 outcomes seems to determine the potential for recovery. I believe that the role of stem cells in cerebrovascular diseases is precisely to guide things towards saving this difference between the 2 outcomes. To emphasize once again, the purpose of stem cells is not to regenerate brain cells, but rather, when there is a mix of living and dead cells and their fate is being decided, whether they will become dead cells or remain living cells, the goal is to help them move towards survival, to preserve their function and keep them alive. The second case showed a more dramatic change on MRI compared to the first case, but clinically, there didn't seem to be a significant improvement in walking after the treatment, so I was a bit disappointed. However, the patient expressed satisfaction, saying that they started to feel movement in their shoulder and strength returning to their ankle. In this way, during the course of treatment, there were more patients than expected who showed improvement in paralysis symptoms or in the areas of cerebral infarction seen on MRI. However, since the treatment was not conducted with a control group or a comparison group, and because it was performed at a private clinic rather than a university hospital, many doctors may think that the effectiveness is not clearly established. Of course, that's a valid point. That's why I've never talked about this in official settings or at academic conferences, and this is the first time I'm sharing this story through YouTube. However, considering that the patients who actually received the treatment were either people I was personally acquainted with or their family members or acquaintances continued to receive treatment, I think it would be best for you to judge the effectiveness for yourselves. And if something like a cerebral infarction were to happen to my family or to myself, I would definitely receive stem cell treatment. There are many opinions about whether bone marrow or fat is better for stem cells, but since the topic is quite broad, I'll organize and discuss these two options in detail next time. Lastly, I'd like to summarize stem cell treatment for cerebrovascular diseases based on my personal experience. Some people feel hopeless after being told that there is no other option besides rehabilitation therapy when they have paralysis symptoms following a cerebral infarction, but that's not true. In the case of cerebral infarction, while the chances are lower in the chronic stage, stem cell treatment during the acute phase can contribute to the recovery of damaged nerve function. The global trend is to recommend considering stem cell treatment as early as possible in the acute phase rather than in chronic cerebral infarction, as this leads to better outcomes. There are many important points to consider when administering stem cell therapy to patients with cerebral infarction, but one of the most fundamental is breaking through or opening the blood-brain barrier to allow stem cells to be delivered from the blood vessels to the brain cells. This is one of the most crucial aspects. Also, when harvesting stem cells, whether from bone marrow or fat, it is important to note that if you extract the stem cells using too much pressure, the cells can be damaged. This is also a very important point, but since it is information that doctors would need to know, I will just briefly mention it and move on. I have never seen a case where stem cell therapy was effective in patients with dementia. Of course, I have seen cases where temporary dementia caused by drug toxicity, not Alzheimer's dementia, improved, but I have yet to see a case where Alzheimer's dementia has recovered. There is a concept called blood stem cells that is advertised in the market. You should be cautious about claims that involve collecting regular blood, isolating stem cells for treatment, or freezing stem cells and then thawing and using them little by little. The above is a summary of my experience over the past several years treating patients with cerebrovascular diseases using stem cell therapy. After suffering a cerebral infarction, there are actually many cases where there are no alternatives. For such patients, stem cell therapy in the acute phase can be a meaningful treatment option, as it may help overcome symptoms like brain paralysis, language disorders, and neurological after effects.